This is Daniel at Recovery Central, and we have some information we want to share this evening about the consortium, which is called DARAC, Daviess Advances Recovery Access Consortium. And the purpose of the consortium is to change the way we see and respond to substance use issues in Daviess County. I want to begin by looking at 2015, just going back a few years to understand what happened in Scott County, Indiana, where Southern Indiana made the map nationally. We had the largest outbreak of HIV in America's recent history in a rural community. 2015 was also kind of leading into a presidential election, and we had a talk from Chris Christie. And so I would just encourage you to go to YouTube. I don't know that I can record this, but look up Chris Christie's plea to change how America handles drug addicts. And then I want to look into what happened a few months after Chris Christie spoke. Not that there was any connection, but it's important to know that about 7 or 8 months after Chris Christie made that talk, about a 6.5-minute talk from his own experience, the U.S. Surgeon General put out a landmark study called Changing or Facing Addiction in America, which called for a change in the way America deals with substance use problems. And I want to point out that in that report, the Surgeon General spoke of a growing momentum to integrate substance use disorder services into mainstream healthcare. The Surgeon General pointed out that it was cost effective to integrate substance use and really other mental health services into mainstream healthcare. It would also reduce intake and treatment wait time, and it would improve health outcomes through better care coordination. And we're talking about coordination. We'll eventually be talking about collaboration, which is going to be something new in Daviess County, but it's very important. And I think as many people of our county as possible need to be aware of it. What the Surgeon General said in that report specifically, and this is literally what the Surgeon General said in 2016, it is time to change how we as a society address alcohol and drug misuse and substance use disorders. You'll notice the word abuse does not show up there. We would associate the word abuse with crime. We have thought of substance use as a criminal behavior. This is not the way the federal government is talking about it anymore. And yet I think that here in Daviess County, this is probably still not very well known. The Surgeon General also spoke of ongoing efforts to reform healthcare and criminal justice systems that are creating new opportunities to increase access to prevention and treatment services. And so if you understand this being understood at the national level in 2016, it does take some time for this understanding to go out. And I think we're going to find as we have more participation with DARAC, this consortium, that what the Surgeon General put out in 2016 has been slowly developing. It is still to this day very respected everywhere in this country. It has been respected by both Republicans and Democrats, and I believe this thing is going to happen. We just need to understand more about it locally. And so we can look at challenges facing rural hospitals. And this is according to the National Rural Health Association. There are other sources on this, and so I would certainly acknowledge you might find other information, and I will not go through all of this in detail, but we know that about 10% of the doctors in the US practice in rural America, while 25% of the population, or almost that much, lives in rural communities. We also know that rural residents are less likely to have employer-provided healthcare coverage, as well as prescription drug coverage. Rural hospitals provide approximately 18% of all patient care, and yet receive only 13% of all Medicare payments. And more than 470 rural hospitals have closed in the last 25 years. And these bullets being a few years old, so it's been a little more than that. And but it helps us understand the plight of rural healthcare, and we definitely have to be aware of it. Rural hospitals are facing a lot of challenges. Rural Americans are typically older and sicker than their urban counterparts. Rural residents tend to be poorer, on the average about $7,500 a year, less income than in rural and urban areas. So rural Americans are more likely to live below the poverty level. And people who live in rural America rely more heavily on what's called SNAP, the Supplemental Nutrition Assistance Program. So there is a lot more, and I won't go into all the financial and regulatory items. There's a lot of information that will help us see the disadvantages for rural healthcare. We just need to be aware. It is very extensive, and it certainly is a factor here in Daviess County. When it comes to substance use in rural areas in general, the emergency department, the ER, can unintentionally stigmatize substance misuse. They probably still call it substance abuse there. And the way that they respond can discourage patients with substance use problems from pursuing medical treatment when they might need it, not just the detox, but other services that are medical. It's also possible that the rural environment can have a punishment orientation around substance use. So that, again, the word abuse is still being used in rural America. They have not heard the Surgeon General's report 6 years later. I don't know how soon that they will, but we have to get this information out there. There's also a low health literacy associated with low education levels and further associated with limited access to resources. People in rural America who have substance use problems typically are not going to know where to go for help. And I see at least the potential to have, and the funding that we are receiving from the federal government that involves the work of DARAC, people working together. It is for us to create a recovery community organization, and for Daviess County to have a real recovery community. If you live here in Daviess County, you need to think about recovery community and try to imagine if you know of any such thing. And if there is a recovery community in the last 20 years, how has that community developed? Is it very strong? What's the evidence of it? My observation so far is we have very little of any such thing. If we did, there'd be collaboration, there'd be a working relationship. One example would be the legal system, corrections, not just corrections, but others. But you would see a recovery community and the legal system working together, being able to respect each other, and not being, one dependent on the other. We can also define an RCO, Recovery Community Organization, as an independent nonprofit organization led and governed by representatives of local communities of recovery. These organizations organize recovery-focused policy advocacy activities. They carry out recovery-focused community education and outreach programs and/or provide peer-based recovery support services. A lot to understand about that one sentence, actually, or two sentences. But Recovery Community Organization, this is just an introduction, but it is an important concept for us to remember, RCO, and we're going to hear more about that. I'm also hoping people can understand the possibility of this picture in a rural community, that there might be a recovery community, there may be some development of a recovery community, but it's very much overshadowed by the legal system. I don't know exactly how this might be happening in Daviess County. I think it is. I think I see this picture here locally. I don't have anybody to blame for it. I don't think we know fully why it develops this way, but I think we need to understand this picture is a dysfunction that is something we need to address. And hopefully that makes sense. And so the consortium, this Daviess Advances Recovery Access Consortium, DARAC, began in November of 2020, and the purpose was community health improvement. It brings together people with healthcare, university services, Purdue University Extension Office, working with IU as well in Bloomington, but also the local hospital, the hospital in Knox County, and possibly other hospitals, working together to make this consortium work for Daviess County. The two major priorities of the consortium are, one, recovery services, and two, community-wide education, such as this. We hope that this information in this video will be getting around to much of our county, and a lot more than just what I'm saying tonight. DARAC is also a multi-organizational collaborative with an emphasis on rural engagement and substance use and mental health services, as well as peer recovery. We'll hear more about peer recovery. I'll introduce it here, but we're going to hear more about peer recovery in the days ahead. The consortium is also, and we've been awarded a grant. As you probably know, we're going to receive $1 million over 4 years for Daviess County. And there's additional grant funding that's already been received in the same effort. And there will hopefully be other funding that will be coming in besides the $1 million. But this is a research grant. And so there'll be active ongoing input from residents to provide immediate response to emerging substance use problems and recovery needs, which will include understanding more about how the COVID-19 crisis has impacted the substance use problems in Daviess County. We really know very little about that at this point. We have just a general understanding of it, but we're going to find out much more in the next few years. Recovery-oriented systems of care, ROSC, is an important concept to understand. This is also mentioned in the Surgeon General's report from 2016. So we're going to hear more about ROSC. We also might be familiar with SOC, which is simply systems of care. And so systems of care and recovery-oriented systems of care work together. And Daviess County is going to have new recovery-oriented systems of care to help us coordinate all of the available resources and treatment available to help people with substance use issues locally. And under the ROSC model, county services need coordination to ensure a collaborative approach to recovery. Services also need to collaborate with people in recovery, which means creating coordinated systems that include people living in recovery throughout the entire recovery process, not just the peer support roles, but other people in a larger recovery community helping those who are in that struggle to recover. The ROSC services are person-centered, they're strength-based, and they involve loved ones and others in recovery and the community. The goals of recovery-oriented systems of care are prevention, early intervention, recovery support, and improved outcomes. And the ROSC will also provide the framework for our consortium, DARAC. DARAC and ROSC are really working together to coordinate recovery support service organizations throughout the county, to develop physical community hub. Much of the task of our next 4 years is to have a recovery hub in Daviess County that will be a deliberate effort to coordinate all recovery services and have connections to people, to services beyond Daviess County, wherever somebody needs to go, whether it's for detox or residential recovery, inpatient, outpatient treatment, support, whatever is there. This recovery hub is going to help make that information much more available to anyone who needs it. And three major hub services would be community navigation. For people in recovery, we might be familiar with the health insurance challenges. We do need some navigation. We already have Medicaid navigators locally to help people with Medicaid health insurance. But we also will see continuity of care for people living in recovery and the promotion of community norms to sustain a more inclusive community. This would mean that in the course of these next 4 years, we're going to have a much more recovery-friendly county. We're going to have employers, schools, churches, other agencies, mental health centers, the healthcare system, showing a great deal of respect to the issue of addiction treatment. The word abuse is going to go away. We're not going to talk about people with drug abuse problems. The U.S. Surgeon General has said these are substance use disorders, and this is substance misuse. It is not abuse. And that's a very important change, along with other language that just has to change. The Recovery Hub will involve procedures for healthcare providers and community partners. Not that we have any doctors calling us up to ask how they can do their job better. I don't think we're going to tell them what they have to do, but we're going to have procedures. We're going to have an understanding of how the treatment of substance use disorder actually works. We're going to have standardized procedures for the hub itself, for the staff working there, as well as training for all hub members to ensure a coordinated system. And it's also, as I said, this grant is a research grant. We're going to develop a community level data system and have a lot of information to help us understand how to make improvements in our services. So here's a little bit about peer recovery services. These are services to people living with an active addiction who are fearful about seeking help or unsure where to go. The peer-to-peer services are from lay people who can sit down with somebody who has a drug problem and meet them in the emergency room or someplace and just begin to introduce them to a recovery community and to respectful services and respectful treatment so they can begin to move forward in recovery. The peer recovery services are part of the hub and spoke healthcare model. So when we say recovery hub, that's also part of the larger hub and spoke model, which is also employed throughout Indiana and other states, possibly the entire nation. I'm not sure, but the hub and spoke healthcare model is for improving healthcare overall. And the peer recovery services will also be boosted through partnerships. So we maximize the use of recovery-oriented services and minimize any duplication of services. We don't want two agencies working completely apart from each other and yet doing the very same things and maybe treating the same clients over and over. We want to minimize the duplication of services and improve the coordination of care and make it more effective. And there's a future for Daviess County, which I believe is going to have to realize the magnitude of the changes to be seen in the next 4 years. We are in these immediate, these recent few months, noticing a lot of people are just not seeing anything of a major change coming. They don't believe, they don't know what to think about $1 million coming in 4 years, as well as hundreds of thousands beyond that already, and probably more to come in the days ahead. But this really is a game changer. We're talking about changes that are being ordered at the national level, and several years later, the federal government is even more engaged to make the U.S. Surgeon General's report a reality for the entire nation, including rural areas. And so we have money from the federal government to change the atmosphere here in Daviess County in a positive way. We're also going to see the emergence of a recovery community with leadership, and some of those leaders may even have felony backgrounds. They've been in jail or prison, but today they are important community leaders, and that is going to require some adjustment, but that is going to be a reality for us. And we hope to have a fully functioning recovery hub, hopefully the next 4 years. In a sense, because of the progress in real recovery and Recovery Central, we would have been a very competitive applicant for this grant. And we already have most of a recovery community organization put together. That was something that would have taken the first year of these 4 years, but I think we are ahead of that game. And I think people need to understand that as this consortium moves forward, we're going to be seeing more respect to what has already started here with Recovery Central and Real Recovery. We also don't want to reinvent the wheel. We are looking at things that have already been done, what the federal government has already taught us. I'm sure that if you think about following federal guidelines, you think about bureaucracy and you think about something that would put us to sleep, but we don't want to spend time trying to invent our own program. We're also doing something that already has legitimate authority at the federal level. We're not trying to turn it into our own local operation. This is something that will be appropriate for the entire country. And so we're not reinventing the wheel. We're going to work with systems of care, recovery-oriented systems of care. The Faces and Voices of Recovery, also known as FAVOR, is a national organization that helps us understand how to build recovery community organizations. The Indiana Addiction Issues Coalition, which began, I believe, in late 2018, if I'm correct, and they are the first RCO in Indiana. They're also a statewide RCO. And so Real Recovery is going to work especially with them. Recovery Central is not an RCO, but a lot of what Recovery Central does is to promote an RCO, and Recovery Central has also been a big boost for Real Recovery. We also get support from the Overdose Lifeline in Indianapolis. We use materials provided by Overdose Lifeline. And we also have a good working relationship with Mental Health America of Indiana. Some of us are familiar with Justin Beatty, who is the president of NRHA and also very engaged. He has been physically to Recovery Central a few times in the last couple of years, and he will continue to work with us. He is still working with us. We've learned a lot from Justin. We'll continue to work with them and with others who will really help this countywide effort be successful. And we hope to share more of this with you in the days ahead. We hope that this makes sense to you. And you can also tell friends that you know, people that you think might want to be involved. We're seeing more doctors getting involved, possibly lawyers, but others, CEOs of businesses, employers, and others who already have some interest. We want to continue to build that. And so we're glad that you're listening to this, and we hope to have more discussion in the weeks, months, and years ahead. Take care.